Thank you, everyone, for joining us today. My name is Rebecca Munnerlin. I'm with the Prisma Health Media Relations team, and we are delighted to welcome Dr. Matthew Bitner to be here with us today to talk about heat-related health risks and some prevention measures for everyone to avoid getting into a medical emergency because of the heat. It looks like Columbia is really heating up this week. We thought we might be breaking 100, but the revised forecast tells me that we might not quite reach that level, but we're still really high in the 90s this week. So I know folks are really feeling it and having to make adjustments to their activities that they're doing this week. And I also wanted to mention that Dr. Bitner is president of the South Carolina College of Emergency Physicians in our state, and we are so proud to have him today to talk to us a little bit about what he typically sees in an emergency environment and some advice that he can provide to us so that hopefully we don't wind up there with our friends or family or ourselves in the coming days of summer heat in South Carolina. I see a few media partners have just joined, so I am going to try to make sure that you all are able to record this locally. If for some reason you're not able to, just let me know. And I think we're good to go. So Dr. Bitner, if you'd like to talk a little bit just about to give an overview of our topic today and let us know what you would suggest we do to protect ourselves.
Absolutely. Thank you for having me, Rebecca. And, as Rebecca mentioned, heat-related illnesses are preventable. And so what we're talking about here is early recognition and prevention, because if you or a loved one shows signs or symptoms of a heat-related illness, there's some very simple steps you can take to prevent further illness or injury. Now, most people are familiar with heat rash or sunburn. Those are all types of heat-related illnesses. As heat illness progresses, patients can experience heat cramps, and you may have heard of heat exhaustion or heat stroke. Now, I want to start with heat stroke because heat stroke is a medical emergency and one that you should activate 911 or your local emergency response system for. So heat stroke is one of the most severe forms of heat-related illness. Patients will have extremely high body temperatures. They may have hot, red, and dry skin. They actually lose the ability to sweat as they lose the ability to regulate their temperature. They may have an abnormally fast pulse, complain of headache, dizziness, nausea, and they could have a change in mental status. So classically, when you think about heat stroke and heat-related illness, anybody who has a change in mental status and is not sweating should be a red flag, because most everybody who lives in South Carolina knows that if you go outside, you start to sweat. And when you stop sweating in the heat, that's actually a problem. Now, heat exhaustion is also very common in South Carolina, but these individuals will still be sweaty. They may complain of some muscle cramping, generalized weakness, or being fatigued or tired without any of the symptoms of heat stroke that I discussed. In those individuals, we obviously want you to move them to a cool place. If they have tight-fitting garments, please loosen them. You could encourage them to take sips of cool water. You should really avoid very super cold beverages and super sugary beverages, but just simple sips of water. However, if those patients begin to throw up, their symptoms are worsening instead of improving with these simple measures, then that is somebody that you should seek medical attention for. Again, if they have any change in consciousness, you should probably be calling 911 and activating an emergency response system. Now, in earlier discussions, we did talk about, Rebecca, protecting specific vulnerable groups. Okay, and so heat-related illness is more accentuated in elderly people, those over the age of 65, infants and children, as well as those who have chronic medical conditions. And last but not least, pregnant women. So Children have a decreased ability to regulate their body temperature, and they have a high surface area, so they're very prone to it. Additionally, infants can't get up and walk to move to a cooler place if they get hot, and they can't help themselves to a beverage if they get thirsty. And so it's incredibly important that parents stay attuned to making sure that their children stay well hydrated and are not exposed to extreme heat. It goes without saying that children and infants should not be left in cars. Even with windows open, a car can increase by nearly 20 degrees Fahrenheit in the first 10 minutes of sitting in the heat. So it happens very quickly. Older adults and those with chronic medical conditions not only don't tolerate swings in temperature well, but they may be on medications that limit their body's ability to sweat and or respond to heat. And so they may not feel the heat. And so it puts them at a higher risk of a heat-related illness.
Thank you so much, Dr. Bitner. That is great information. I know that we've had some interest in talking to one of our populations that deals with diabetes in particular. And I wanted to ask you if there are some things that diabetics should plan for a little differently, if they should take any special measures to make sure that they are prepared to deal with, potentially high heat situations.
Right. So many diabetics know when their blood sugar gets low. However, some diabetics don't know when their blood sugar gets low because diabetes, again, alters some of the neural pathways. Just like diabetics may lose sensation and feeling in their hands or feet related to diabetic neuropathy, they also have a diminished ability to respond or feel the effects of heat. Additionally, diabetics are on medications that impair their body's ability to respond to changes in temperature. And people with chronic conditions, people who have poor blood circulation, people who are obese, retain more heat, and that makes it difficult for their bodies to respond to these extremes of heat.
Thank you so much for addressing that. I'd like to make sure that our media partners know that they're welcome to post questions in the chat, and we will address those as you post them as much as we can. And Dr. Bitner, you did pay special attention to how children regulate their body temperature differently, or perhaps not as well, particularly young children under 2. Are there any other special measures that you would recommend for parents that are out on vacation, at the beach, things that they may catch them off guard if they're not really paying attention to certain indications that from their children?
Right. So, a good rule of thumb is that if you are hot or you are thirsty, your child may be hot and or thirsty. Obviously, dress them in lightweight, light colored clothing that doesn't absorb heat. For those who have very small infants, pay attention to if they're having a normal frequency of wet diapers. Any change in diapering could be a sign of dehydration. They're subtle signs, but in general, they just cannot tolerate the duration or exposure or intensity of the heat that we unfortunately get in South Carolina these days of the summer.
What about incidences of sunburn? Do you see many extreme cases of sunburn coming into the ED when folks just seem to lose track of how much exposure they've received?
So we will occasionally see sunburn come into the emergency department and realize that sunburn is a thermal burn. It's just UV radiation. However, I would say, again, it goes back to individuals with chronic medical conditions. There are some medications, including some classes of antibiotics, that increase photosensitivity. And so even what you would normally be a normal amount of sun that you would be able to tolerate could result in a significant burn. So if you are either on medications or are starting new medications, make sure you discuss with your physician and or your pharmacist if they could trigger photosensitivity.
Good to know. Talking about teens and young adults who are involved in outdoor sports, whether school's out right now, but there are probably some teams already practicing and having certain activities, and then also leagues and communities where folks are out still playing soccer and other sports. What are some tips for young folks who I know sometimes tend to think they're immune from some of these things happening to them, but if you could maybe give some advisories to how younger adults and teens might be better prepared for being outdoors.
Absolutely. And, the good news is that there are organizations within our state that have spent a good deal of time in terms of training coaching staffs to recognize heat illness. Obviously, you want to limit outdoor activity or move your practices to earlier in the day or later in the day so you are not at the peak of temperature. Students should pace their activities, okay? So you need to warm up and then pick up the pace gradually. This is not something you should just go from an air-conditioned house out into 90-degree weather and be running sprints at full pull for, however long your coach is saying. You should work into it easily. Additionally, you should drink more water than you usually do. If you wait until you're actually thirsty, then you're actually behind the 8 ball. Obviously, muscle cramping is an early sign of heat-related illness. And I think it's actually true for young adults in sports as well as elderly patients and just in our neighborhoods and communities is like have a buddy system. So, if you are an athlete and you have a buddy that you keep an eye out to whether or not they're showing signs of heat illness and make sure that they're looking at you. Because if you remember, as I first started out talking about heat stroke and changes in mental status, if you are a victim of a severe heat-related illness, you may not know that you are a victim of severe heat-related illness. And so having somebody keep an eye out for you is always good, especially if you're in a community that may struggle with social determinants of health and you have neighbors that don't have air conditioning. Pick a buddy system, keep an eye out for those that are vulnerable populations.
That's great advice, especially for young folks. I think it makes us accountable to each other at every age to say, hey, I'm going to keep an eye on you and I hope you'll keep an eye on me and make sure we get through this day without any problems. I have a question about dehydration. Can that come on quickly and unexpectedly? You mentioned that you need to obviously continue to do those, the water intake and electrolytes replacement as particularly if you're active. How quickly does that happen? And what are some other early indicators of dehydration?
So dehydration can come on quickly, but the unfortunate thing is that it's different in every patient, right? So part of it has to do with what your pre-activity hydration status is, whether you're properly hydrated before you start your outdoor activity. Or whether or not you are mildly dehydrated to begin. As we mentioned earlier, infants, children, and pregnant women can become dehydrated relatively quickly. And so that can come on mainly because they don't recognize the early signs of heat-related illness.
Right. We have a question also about folks who do their jobs in the heat. We have I know in my neighborhood, there's a lot of construction going on and a lot of folks out working in the heat of the day. And I've noticed particularly that a lot of those folks where you might think they would strip down to be cool, they're actually covering up. And I wondered if you could talk a little bit about that and what folks who really to do their everyday job, what measures they need to take, maybe beyond the ones you've mentioned, just in terms of being prepared for pretty much a full day out in the sun.
Understood. Workers whose primary job function involves being out at heat must do some level of acclimatization. So, if you're starting a new job, it might be that you do shorter bursts, like 4 hours, 6 hours, 8 hours to build up to being able to deal with that sort of dose of heat. We've already talked about pushing fluids. We talked about avoiding sugary drinks. Obviously, adults and workers prior to work, we obviously don't want them drinking alcohol while they're at work, but even alcohol the night before sets you up again to that pre-activity state of being dehydrated. And then, yes, they can cover up, but it should be relatively like a loose, wide-brimmed hat. Again, light-colored clothing or reflective. You'll see a lot of safety gear. The good news is not only does that keep them safe on our roadways and their work sites, but it also reflects heat and does not absorb heat. And then They need to take sort of iterations where they spend time outside of heat. So regularly scheduled breaks, if you're supervising a team, cycling your team through air conditioning, even if that's 10 minutes, in a pickup truck with a cool drink, it doesn't mean that you have to remove them from the work site as much as you just need to ensure that everybody is taking time to recoup and recover so that they can be the best version of themselves when they show up to do their job.
Thank you. Great advice again, Dr. Bitner. Well, I think we've taken all of the questions that we've received, and I hope that our listeners and our media partners will share this information so that everyone gets through the summer safely without incident and takes those precautions that Dr. Bitner has so generously offered us. And so I guess, Dr. Bitner, unless you have any final thoughts, we'll go and just wish everybody a safe, happy summer last few months as we enjoy kids out of school and folks taking their vacations and getting out and enjoying the sun a little bit, but in a safe and well-informed way.
Yeah, I would just close with what I started in, that heat illness is preventable. If you recognize the early signs or symptoms, you can take strategies and tactics to stay hydrated, be able to still enjoy the outdoors during this season. There are other great local resources. You can either check the Prisma Health website, you can check cdc.gov for heat-related illness information, and just get informed before you choose your outdoor activities.
Perfect. Thank you again so much. We appreciate everyone participating with us today and wish you a happy and safe summer.